Why Cuba is vaccinating children as young as 2 against COVID? Cuba's medicines regulator agency, CIMED, authorized the emergency use of domestically produced Soberana 2 vaccine for minors between the ages of 2 and 18. Cuba has become the first country in the world to authorize the use of coronavirus vaccines for children as young as 2 years old. The country will be administering its own homegrown vaccines, which have not been recognized by the World Health Organization to inoculate children and adolescents aged 2 to 18 against COVID 19. Earlier this month, Cuba's medicine regulator agency CEMED announced that it authorized the emergency use of the domestically produced Soberana 2 vaccine for minors between the ages of 2 and 18. Despite grappling with severe shortages in food and medicine, Cuba has focused on developing its own vaccine rather than depending on other countries. While local scientists say the Cuban vaccines are safe and effective, there is very little data available to the public to prove their efficacy. With most other countries adopting a more cautious approach as far as vaccinating children is concerned, some health experts have criticized Cuba for being too hasty in its bid to vaccinate most of its population. So, why is Cuba in such a hurry to vaccinate young children? According to the Cuban government, the nationwide inoculation drive for children was being sped up with reopening of schools in mind. The government said it plans to gradually reopen schools for in-person instruction in October after the vaccination campaigning among children is completed, Voice of America reported. Since the pandemic first made its presence felt in the island nation, schools have been functioning virtually. Children have been directed to watch educational programs on television as home internet remains out of reach for many. According to UNICEF report released last year, children in Latin American countries have lost 4 times as many school days as other children around the world. Anxious to get students back in the classroom, the Cuban government has said schools will reopen for in-person classes once all children are vaccinated. Initially, the focus of Cuba's vaccination drive was inoculating frontline workers and elderly people in badly affected areas. But after a spike in infections among children following the emergence of the Delta variant, the government started to shift its focus to vaccinating younger children. With the rise in positive cases of COVID 19 in children, it's necessary that the family protects itself more, and so we are protecting our children and adolescents. The island's chief epidemiologist Dr. Francisco Duran Garcia told CNN. The Cuban government has also said that it seeks to vaccinate at least 90% of its population before reopening international borders in November. What do we know about the vaccines being used to inoculate children in Cuba? So far, the country is using 2 vaccines, Soberana 2 and Abdala, both of which has been approved by local regulators but are yet to be peer reviewed. Both the Soberana 2 and Abdala vaccines are conventional conjugate vaccines, which means that a part of the coronavirus spike protein is fused with a carrier molecule in order to boost both efficacy and stability. Children and adolescents in the 2 to 18 age group will receive doses of Soberana 2 while adults will receive Abdala. The vaccination plan for children is the same as that for adults, 2 doses of Soberana 2 followed by 1 of Soberana Plus. Cuba on Thursday said it is seeking World Health Organization approval of 3 COVID-19 vaccines according to state-run corporation that produces them, Reuters reported. Are other countries vaccinating children this young? While no other country has approved vaccination for children as young as 2, some have started vaccinating slightly older children and adolescents. Countries like the UAE, China and Chile have authorized some vaccines for younger children. In Chile, children aged 6 and older can get a dose of Sinovac vaccine. Meanwhile, in China, both the Sinovac and CoronaVac shots can be administered on children as young as 3, CNN reported. The UAE too will soon permit parents to vaccinate toddlers as young as 3 as part of an optional pediatric vaccination program. The United States as well as several European nations such as France, Germany, Italy, Ireland, Spain, and Poland have already rolled out their vaccination campaigns for young adolescents between the ages of 12 and 15. The UK, meanwhile, has taken a far more cautious approach. Shots for 12 to 15-year-olds were only recommended recently following advice from the country's top medical officers. The reason some countries are being criticized for vaccinating children and other low risk groups is because billions around the world, particularly in low income countries, have not received even one shot. Earlier this year, when some wealthy countries started vaccinating children, World Health Organization Chief Tedros Adhanom Ghebreyesus said they were doing so at the expense of health workers and high risk groups in other countries. Thank you.